Lose water or lose your career. Australia's leading wicket taker Shane Warne was suspended from cricket in 2003 for 12 months after the player tested positive for a banned diuretic. Warne was very angry at the time and claimed to be devastated and has never ever taken performance enhancing substances, but admitted that he took a drug known as Moduretic without knowing it was a diuretic, but believed it was a fluid tablet. Moduretic is a pharmaceutical tablet composed of two different diuretics, amyloid hydrochloride and hydrochlorothiazide, in combination known as co-amylazide. This is prescribed by doctors for patients that require the removal of excess salts and body fluids. Diuretics are useful medications for patients who have high blood pressure or heart failure. Patients with heart failure have swollen feet and a frothy cough, and Moduretic usually helps relieve their symptoms. Diuretics are also used to treat conditions such as hepatic cirrhosis, ascites, and liver failure to get rid of swelling from feet and the belly. The way Moduretic works is attributed mainly to how amyloid hydrochloride and hydrochlorothiazide work, and they are both diuretic and antihypertensive medications. Amyloid hydrochloride is an orally administered potassium-sparing diuretic with mild natriuretic and diuretic properties. It exerts its potassium-sparing effect by inhibiting sodium reabsorption at the distal convoluted tubule, cortical collecting tubule, and collecting duct. This action inhibits reabsorption of sodium and chloride ions back into the blood, resulting in loss of sodium and water without loss of potassium. The mechanism of action of amyloid is independent of aldosterone. Hydrochlorothiazide is the thiazide diuretic that acts directly on the distal convoluted tubule of the kidneys. It inhibits water reabsorption in the nephron by inhibiting the sodium chloride symporter. Now, normally the sodium chloride symporter transports sodium and chloride from the lumen into the epithelial cell lining the distal convoluted tubule. The energy for this is provided by a sodium gradient established by sodium-potassium ATPases. Once sodium has entered the cell, it is transported out into the basolateral interstitium via the sodium-potassium ATPase, causing an increase in the osmolarity of the interstitium, thereby establishing an osmotic gradient for water reabsorption. By blocking the sodium chloride symporter, hydrochlorothiazide effectively reduces the osmotic gradient and water reabsorption throughout the nephron. The combined action of the two in Moduretic begins to work within 1 to 2 hours, and its effects last up to 24 hours. The use of diuretics in sport is banned by many competitive sporting associations, since the use of diuretics provides certain individuals with an unfair competitive advantage. Some athletes take diuretics to quickly shed water weight, almost about 6 liters worth in a period of 24 hours. This is important in many speed sports as they increase the speed of an athlete. Other athletes have been known to take diuretics to mask the presence of performance-enhancing drugs in their urine, in an attempt to beat a urinalysis they must take before a competition. As for Mr. Warne's uses, he claims that he had been doing a lot of wine promotions at the time, and it was to get rid of a double chin. It should be noted though that Warne dislocated his right shoulder in a fielding accident on December 15. He made a quicker than expected recovery and returned to the team in time for the VB Series finals. So, was it to cover his injury, or was it for appearance, or was it because he was using steroids? Diuretics continue to be essential in the medical profession in order to treat hypertension and oedema. However, their use in the sporting industry will continuously be monitored.